Hi, I'm Bob Hilke, and today I'm going to share how you can have better healthcare, happier employees for half the cost, because that's exactly what we're helping companies do at Premier Alignment. We are changing healthcare. We're helping companies implement healthcare that employees love because it offers employees more choices. And oftentimes, they don't even have premiums, deductibles, or copays. For the company, it helps them save a lot of money because we cut the cost to half that of traditional healthcare. In America today, companies are paying almost $14,000 per employee per year on average, and we get the cost down to around $6,000 or $7,000. Better employee benefits attract and help retain top talent. We teach CEOs and their executive team that they should treat healthcare as a strategy, and we align healthcare to work for the CEOs and their employees. We help companies implement the only healthcare model to have ever received the Presidential Malcolm Baldridge Award for Quality twice. And our consulting has helped our clients cut their healthcare costs by 30 to 60% of what they had been spending. Because healthcare is such a large expense, oftentimes by cutting the cost in half, that will double the company's profit margin. Our consulting can begin anytime during the year. It's not necessarily tied to open enrollment. Once we implement our model of healthcare, the employees have more choices. Depending on the objectives of our client, their employees might no longer have premiums, deductibles, or copays. And because they love this model of healthcare so much, the CEOs can use this as a strategy for attracting and retaining top talent. It also mitigates risk for the company and its leaders because recent legislation makes companies and their leaders fiduciaries when they make healthcare decisions for their employees and when they require employees to pay for the cost of their healthcare. We offer a money-back guarantee on our consulting, and we're helping CEOs solve the biggest problem they don't know they have. This slide shows the comparison between a traditional approach of healthcare acquisition and a recommended approach with a consultant advising the executive team and their broker. So let's talk about the traditional approach. Usually, the CEO hands healthcare shopping over to HR or maybe a chief finance officer or some other executive in the company. And when that happens, the CEO, who is the chief negotiator for the company, but now the CEO is not involved in the process. So he or she is out of the loop and not able to negotiate a 50% cost reduction in healthcare. HR does what they did last year, and that is one of the options that the broker presents. But brokers are aligned with big insurance companies, and they're going to bring to the table the things that make the brokers money. So they're not going to present all the options that are available. They're only going to present the options where they make money. With the traditional model, there's nobody with industry insider experience advising the executive team or helping with the decision process. There's nobody challenging the process, the benefits, or the cost. When you do the same thing each year, you get the same results each year, except it costs more. The cost today for traditional healthcare on average is almost $14,000 per year per employee. And that's the company's cost, by the way. Employees typically have to pay hundreds of dollars towards premiums, and they have deductibles and copays when they go to use their health insurance. I put the actual numbers here that is in my wife's insurance policy. It's $10,000 deductible and $15,000 out-of-pocket max. With an industry insider consultant advising and helping the executive team, the consultant can bring lots of other options to the table that the broker won't bring. What we do is align the broker to work for the CEO instead of for the big insurance companies. The broker is still going to be paid, and the broker will be rewarded as the broker helps the CEO achieve the CEO's business objectives. The consultant works with the broker and with the executive team to implement new innovations. The results with the consultant include the company's cost of healthcare going down to the range of around $6,000 or $7,000 per employee per year, half the cost of traditional healthcare. And employees now have more choices, and they may even no longer have premiums, deductibles, or copays. Because employees love this healthcare model, the CEO can use healthcare to attract and retain top talent. The broker is rewarded when he or she helps the CEO achieve the CEO's business goals. So how do we do it? How can we possibly cut the cost of healthcare in half of traditional healthcare? Well, here's how. Brokers present options that help brokers earn money, and their options are generally expensive and they cost more each year. Healthcare in the United States is the largest industry. Half the cost is fraud and waste, and that fraud and waste is $2 trillion. That's the size of Russia's economy. So just think if we could get rid of that, how much less expensive healthcare would be for everybody. Healthcare incentives are aligned against companies and their employees, but we help companies avoid the fraud and waste part of the healthcare industry, and we align the incentives of healthcare to work for our clients and their employees. Premier Alignment has industry insider consultants that bring many years of experience and many more innovative options to the table. And these options are what help save the company a lot of money and provide better healthcare with better health outcomes for the employees. Contingencies for hospitalizations, surgeries, catastrophic cases, etc., are included in the comprehensive model we help companies implement. Premier Alignment is not a broker, and we don't represent any insurance company. So you still need a broker, and we work with your broker and train the broker to help us implement this new model of healthcare. But if the broker is not interested to do that, no worries. We have other brokers that are already trained and certified on our model of healthcare. You need an experienced industry consultant in order to achieve the desired innovation. So why not schedule a free strategy session and learn how our industry insider consultants can align healthcare to work for you and your employees, reduce the cost of healthcare for your company, and offer healthcare that your employees will love. To schedule a free consultation, you can go to premieralignment.com, or you can type in the browser tinyurl.com/Premier Alignment Discovery. Either way, you can get to my calendar and I'll be glad to meet with you and discuss how we can help your company implement an amazing model of healthcare that your employees will love.